I am here to discuss a topic of HIV and AIDS control program. In this session, we will discuss about the goals and objectives of this program, what are the screening methods and testing facilities and other key considerations of this program. So, let us start. The National AIDS Control Program, which was launched in India in 1987. Okay. So, the main goal and objective was to prevent and control this HIV. Now, we will see the phases. So, this was launched in 4 phases. The first phase, National AIDS Control Program first, which was launched in 1992 to 1997. The second phase was launched in 1999 to 2004. The third phase is launched in 2006 to 2011, and now we are on the National AIDS Control Program phase 4, which was launched in 2012 up to the 2017. Now, we will see the goals and objectives of these program. So, the objective number 1, it is launched to reduce new infections by 50%. 2007 was taken as a baseline of National AIDS Control Program third. Yes, because we are talking about the National AIDS Control Program phase 4th. So, baseline was taken as NACP third. Now, so objective number 2 is the comprehensive care. Okay. HIV AIDS patients need the comprehensive care because they are the terminal patients, stigma is involved with them. So, they required total care, they require the support, the treatment by the antiretroviral therapy of all the persons who are living with HIV AIDS. Yes. Now, see what are the other points in it. There was one of the initiative which is known as 3x5 initiative. Okay. This initiative means we are targeting on the people who are living with HIV AIDS in the world. Yes, and our target is to complete the 3 million population by the 2005. Yes. So, see 3x5 target which was announced by WHO and United Nations AIDS on December 2003, and our main interim target is providing the antiretroviral therapy or antiretroviral treatment for the AIDS to 3 million people. Yes, total people are 40 million. So, from 40 million people who are living with HIV AIDS, we have set a target that we will provide at least to 3 million people this therapy, antiretroviral therapy by 2005. Yes. So, our ultimate goal is the universal access of the antiretroviral therapy to all of the patients who are living with HIV AIDS. Now, coming to the focus areas. There are 5 pillars in this HIV and AIDS control program. Now, what are these 5 pillars? We have simplified the standard tools to deliver ART. Simplified version means the people who are not able to access the antiretroviral therapy. So, we have simplified it. We have made some local areas where we can provide these therapies, where we can provide the facilities for the testing of HIV also. Yes. Then a new service to ensure effective and reliable supply of medicines. We have to ensure, because this disease we are targeting. So, we have to ensure the supply should be reliable, supply should be trustworthy, the medications which we are providing to the population to get rid from this disease or to prevent or to control the disease, that should be the effective, the measure should be effective. Okay. And what are the diagnostic facilities? So, testing facilities for the HIV. In the next slides, we will discuss about what are the testing facilities for the HIV. So, we will see in later of these slides. Next point is the we have to spread the information and we have to apply the knowledge to implement the successful technologies we have. Yes, then only we can prevent the disease, we can control the disease in the population. Yes, then urgent and sustainable support to the countries. Without the support of the countries, without the support of the international partnership, state level, national level partnership, local level partnership, we cannot implement our programs. Okay. So, this is the fourth point, and fifth pillar is the global leadership. This I told you, we need the international partnership as well, backed by strong partnership. Yes. So, these are the pillars, focus areas. We will focus on them. Of course, we can implement our programs in a better way. Then, I was telling you about some diagnostic facilities. So, see how will assess, yes, the patient is suffering from this infection or not. So, HIV screening in National AIDS Control Program, we have some screening methods like ELISA, rapid and simple. ELISA is most used because it has a higher sensitivity. ELISA is enzyme linked immunosorbent assay. Yes, in this test we are trying to identify the antibodies. Yes, antibodies which are specific with this infection. Yes, then there is a rapid test. Rapid test means this is the fast test, and we are identifying the antigen present. Okay. So, antigen specific to the HIV infection. Now, there are some simple tests like we can go for the saliva test. Yes, we can identify the antigens present in saliva, or we can go for some blood test. So, these are the screening methods. Yes. Then after the screening, there is a one confirmatory test. Yes, which will confirm the infection. So, test for the confirmatory diagnosis of HIV under the NACP, National AIDS Control Program, is Western blot assay. This is important here. Yes. So, we are using the Western blot assay. The mechanism for the Western blot assay on which it is working we will discuss later. Now, coming to the screening strategies of HIV, when the strategy 1 is used, 2 or 3 is used. So, strategy 1, there are some conditions on which we are using only a single test or a double test or a triple test. So, we will see when we are using which type of test. Yes. So, there are means first we will see the strategy 1. So, in this strategy 1, we have 3 screening methods E, R and S, ELISA, rapid and simple. Yes, and I told you ELISA is the most sensitive test. So, strategy 1 is used when we are doing only a single test. So, 1 out of 3 screening tests are used. When it is used, there is one condition, done for screening every blood unit before transfusion. When we are taking the blood sample or donating the blood, okay, so means at the time of blood transfusion, we have to check the infection. So, the screening methods for the HIV, here is the only we will use one test, okay, out of all these 3. So, yes, it does not recommend its use for the diagnosis for HIV in a person. Yes. So, it is only used for the transfusion, blood transfusion. Now, the strategy 2 means we will use the 2 tests out of all these 3, E, R and S. So, we will pick 2 tests in these 3. When we will do this? Yes, see, done for the screening person who is symptomatic, means the person is showing the symptoms of the AIDS. So, when the person is showing the symptoms, then we can go for the strategy 2. Yes, under the NACO guidelines. So, NACO guidelines is National AIDS Control Organization guidelines. Yes. Then after that there is a strategy 3. So, we have 3 strategies. Yes. Strategy 3 means we will use all of the tests. So, we will use E, we will use R, we will use S. Okay. When we will do this? When the person is not showing any symptom of HIV and we have to screen. Okay. At the time we will go for the ELISA, at the time we will go for the rapid and simple test. Yes. Now, I already told you ELISA is a most sensitive test, that is why it is more preferred. Yes. Coming to the diagnostic test, I told you there is one test which is known as Western blot assay and also known as immunoblot. It is used for the confirmation of the HIV infection. Apart from it, there are some other tests as well. We will discuss about the other test also. What we will do in the Western blot assay, see, in this we are detecting the specific protein, yes, and these proteins are present in the sample. Sample means the blood sample. So, a specific protein in a sample of the tissue homogenate or extract. Yes, we are identifying here viral core protein P24. Okay, whenever the person is infected with HIV, at the time this viral core protein is present in the sample, and also there is a glycoprotein, envelope glycoprotein, yes, which is encoding the virus. So, that is a GP41. So, both are showing the presence in the sample, and this is we are detecting. Yes, how will detect this? So, there is a one mechanism on which the Western blot assay we are doing. We are using a method of electrophoresis. Yes, in this electrophoresis we are separating out the proteins. Yes, so we are seeing the protein transfer to a membrane. Yes, and that specific proteins will check it. Yes. So, probe detection method, by this method we are checking is the specific proteins are present, specific antibodies are present, which is showing the confirmation for the HIV infection. Yes. I told you apart from the Western blot assay, there are some other tests for the confirmation as well, like P24 antigen. Yes, in this we are detecting the P24 protein of the HIV. This is the genetic content. Yes, which is present in the HIV, yes, human immunovirus, human immunodeficiency virus. In this virus, this protein is present. So, we can also check the antigen. Then we can also check the nucleic acid present in the sample. So, known as a nucleic acid based test. Yes, we are checking the sequence or specific sequence, nucleic sequence. Yes, there is a one gene, HIV GAG gene. So, this we are identifying. Yes. After that, there is a one test called as RT-PCR test. So, for the viral detection, this is a very familiar test. These are days we are also seeing recombinant technology, polymerase chain reaction test. Yes. So, in this test we are amplifying. Yes, we are using the amplification. So, we are amplifying these segments, and then only we are detecting the presence of the antigens. Yes. Then there is also one test which is used as a confirmation for the HIV infection, like quantiplex branch DNA. Okay. So, in this what we are doing, we are using the centrifugation method. We will pass our sample through the centrifugation, and then will release the RNA content from that sample which we have passed through the centrifugation. So, whatever the RNA we have separated out, that will amplify. Okay. Before the amplification, we are adding some oligonucleotides. Yes, this. So, in this procedure, when we are adding the oligonucleotides and we are amplifying the process, at the time we will also add an enzyme, and that enzyme, when in presence with these oligonucleotides or the RNA, it will cause the color reaction. Depending on the color, will identify the infection. Okay. So, these are some of the tests we are doing for the confirmation of the HIV in the National AIDS and Control Program. Now, in the National AIDS and Control Program, we have the targeted interventions. Yes. So, what is the target in interventions experimentation we are doing in the NACP, National AIDS Control Program? Our basic purpose, yes, our basic purpose is to reduce the transmission of HIV. Yes. So, if we are reducing the transmission, we have to target a basic or a particular group of population. So, what is a particular group of population we will discuss later. So, transmission of HIV amongst the most vulnerable population. Who is the most vulnerable population? We will see. What is the approach? We will combine a comprehensive and integrated approach to a vulnerable segments of the population. Yes. So, main activities for those type of population is to change the behavior towards the HIV, okay, to change the behavior so that the transmission can be prevented. Okay. We have to use the communication, because the people are not aware which the screening methods, what are the diagnostic methods, when to go for the test, okay, what are the treatment strategies, how much the treatment we should take, how we can prevent it. So, these type of communication is used between these groups, yes, the vulnerable groups. This is required to prevent the transmission effectively, yes. Then treatment of sexually transmitted diseases, okay. Then enabling environment to facilitate behavior change. So, we have to create that environment so that we can change the behavior, yes, and when we will change the behavior towards the disease, so that we can prevent the transmission of the disease. Now, before this slide I discussed about the vulnerable population. Who is the vulnerable population, who is more prone for the HIV infection? So, sex workers, because this is a sexually transmitted disease, yes. So, they are the vulnerable groups. We can communicate to them, okay, we can spread the information regarding the HIV, how to prevent it, how to prevent the transmission, how to control it, what are the treatment part. Then injecting drug users who are involved with the injecting drug, okay. Then truckers who are moving from one state to another, one part to the another part, they are more prone, they are more prone in these activities, okay, the sexual activity. Then homosexual man, means man having sex with man. Then migrant laborers, okay, these section, the rural areas, street children who are not aware about it, they are more prone in these activities. That is why they are more vulnerable for the HIV infection, yes. Now, what is the opt-in and opt-out testing? This is also under the National AIDS and Control Program. There are two strategies we are using, opt-in testing and opt-out testing. Most of the time we have seen, means many of the tests reported from the opt-out strategies, yes. So, let us see the difference between the opt-in and the opt-out. Opt-in testing is the testing in which the patient is required to actively give permission. Patient will come to the clinic and will say, yes, I want to go for the test, okay, I want the test. So, this is the opt-in, means the active participation, yes. Opt-out testing means when the situation demand the test, like in the pregnancy we are preferring for the HIV test, yes. So, that is the opt-out, means the situation demands for the test. So, opt-out testing means performing an HIV test after notifying the patient that the test is normally performed, like the condition I told you in the pregnancy, but that the patient may elect or decline. So, patient can decline or patient can select, yes, I want to go or I do not want to go, or deferred testing, okay. So, consent or assent is then assumed unless the patient declines the testing. So, this is the basic difference here, okay, active participation and the passive. So, as I told you, WHO and CDC, these are the committees which are recommending the opt-out testings policies in healthcare settings. So, majority of the tests are reported in this area from the opt-out testing, where the situation actually demands, yes, 85 to 98%. Now, what is the lack? Link Art Center, this is also under the National AIDS Control Program, yes, in India, which was launched in the phases. So, lack is the, we are linking the antiretroviral therapy, okay, we are linking these centers so that we can simplify the supply, okay, supply of antiretroviral therapy to the vulnerable groups. Now, what are the points under this? We are providing the antiretroviral drugs to patients, okay, on antiretroviral therapy, who are already on the antiretroviral therapy, so that the compliance, we are actually targeting on the compliance. Okay. So, no patient will be out of the situation that the patient is not getting it, okay, just because of some of the issues or not able to access the facilities. So, that is we are simplifying here. Now, monitoring of the patients on the ART. So, we can go for some diagnostic test, what is the infection level, okay, what is the CD count, this we are checking here in the monitoring. Then treatment of minor opportunistic infection. As I told you, this HIV infection is the sexually transmitted infection, and in this this HIV virus is targeting on the immune system. Yes, when the immunity will be low, what will happen? There are some other infections we are prone with. So, like fungal infections are there, there is a tuberculosis, okay, whatever the latent form of infections present in a body will get it. Yes. So, we are treating the minor opportunistic infections as well. So, means if the patient is suffering from fungal infection, we will treat it. If the patient is suffering from TB, so we will treat it. So, this is under this point. Now, coming to the identification and management of side effects. Yes, the drugs which the patient is taking, medication the patient is taking, there are some side effects. So, we have to treat them as well. Then reinforcement of drug adherence on every visit. This is very important in not only the HIV, but also for the other diseases as well. Yes, drug adherence to comply the medication. It's very important to reduce the burden of the disease. Yes. Now, after that, LAC means the Link Art Center. We have a plus program, Link Art Center Plus. What is plus? What is added here? See, we are integrating HIV care to general health system. So, whatever the primary health care centers or the community based health centers, health camps for the HIV, okay, for the screening of the HIV, AIDS. So, we are integrating this care on the general health system. We are trying to implement it on the local centers as well. This is under the plus. Then reduce loss of the patients. Yes, between ICTC and care support and treatment services. Okay, so the side effects we are talking here about the side effects, the adverse effects. Okay, so we are also checking all of them. We are trying to maintain the compliance of the patients. Yes, this will do in this. Reduce loss of patients between care support treatment services. Then coming to the global initiative to end adolescent AIDS. This is one of the initiative on a global level. Yes, we are targeting here the adolescent group. Yes, adolescent who are prone to get the HIV infection. So, there is a involvement of UNAIDS, United Nations program for the AIDS, and UNICEF, yes, United Nations Children's Fund. So, these two organizations, they have taken this initiative and they have done the partnership to reach the adolescents, okay, who are suffering with the HIV. So, we are providing the HIV services so that we can end the AIDS epidemic, especially for the adolescent, by 2030. Okay. So, what they did, there are 4 key areas, 4 key action areas. What are the action areas? Adolescents as leaders and actors of the social change. Yes. Then we have improved the data collection. Okay. So, whatever the cases are reported, we have to write them, and the contact tracing is important. Okay. So, whosoever is in contact with that adolescent who is suffering with the HIV, we have to note them and go for the screening or the diagnostic test. Okay. Then encouraging innovative approaches to reach adolescents. What are the innovative approaches? How we can communicate to them. Okay. So that we can prevent the burden. Then placing adolescents HIV firmly on political agenda. Yes, of course, because for every diseases, not for the HIV only, we are trying to reach all of these issues on the political level as well. So, these are some of the targets which we have to achieve by 2020. We are reducing the HIV infection by at least 75%. So, these are the values, you should keep note on these values. We are reducing the AIDS related death by 65%. Okay. Discrimination, because this disease is related with the stigma in the society, yes. So, we have to reduce the discrimination as well. So, the level should be 0 by 2020. Okay. So, there should not be any discrimination. What are the main goals? We want to end the adolescent AIDS by 2030, I already told you, and ending the global AIDS epidemic as public health threat. Okay. So, these are some goals. Thank you so much everyone. I hope this is clear to all of you about the National AIDS Control Program, what are the screening method, diagnostic methods, and what are the other key points under this. We will meet in the next session. Thank you so much everyone.